aligning your heart health goals with your doctor, finding the perfect match. Hi, I'm Dr. Philip Ovadia, America's heart surgeon and your guide to navigating the path to optimal heart health. Today, I'm going to break it down because most people underestimate the importance of having a doctor whose heart health vision is aligned with theirs. Here's what we're going to talk about today. First, identifying a doctor who truly understands your heart health goals. Then we're going to talk about the transformational power of a doctor-patient relationship in achieving heart health. Finally, we're going to talk about some key strategies for ensuring your doctor's approach complements your heart health objectives. Let's get started by talking about identifying a doctor who truly understands your heart health goals. I have 3 tips for you on this. The first is recognize the importance of a doctor who listens and engages with your heart health concerns. Now, this may seem like an automatic when you go to the doctor, but understand that your doctor may not be fully engaged with your heart health concerns. And if your doctor isn't taking the time to listen to you and to understand what your concerns are regarding your heart health, they are not going to be able to optimally guide you to good heart health. My second tip is understanding the importance of finding a doctor who is knowledgeable about the latest in heart health research and treatments. Most doctors are overwhelmed trying to take care of all of the sick patients in front of them, and they don't have time and don't prioritize keeping up on the huge volume of ongoing research. Studies have shown that it takes an average of 10 years for material to translate from being printed in journals to actually getting into doctors' everyday practice. So talk to your doctor about what research they're reading and figure out if they're still stuck in the paradigm that was taught to them way back when in medical school, or if they are making an active effort to stay at the forefront of heart health. And my final tip are some strategies for communicating your heart health goals effectively to your doctor. Make sure that you take time during your appointment to stress to your doctor what your heart health goals are. Because what they're thinking your heart health goals are and what your heart health goals actually are can be 2 very different things. And most doctors are going to default to what they think everyone's heart health goals might be. Something like having the lowest cholesterol level possible. And that may not align with your heart health goals. So make sure that there's time during your appointments to discuss this. And if there isn't, big red flag that you might not be seeing the right heart health doctor. Now, let's talk about the transformative power of a doctor-patient partnership in achieving heart health. First, I want to talk about how collaborative goal setting with your doctor can lead to more personalized care. When you and your doctor take the time to discuss together what your heart health goals are and how you want to go about reaching those goals, that sets you up for a positive, engaging relationship that's going to lead to good long-term success. Again, if your doctor doesn't or won't take the time to do this with you, it may be time to find another doctor. Next, I want to talk about the role of mutual respect and understanding in a successful heart health journey. Again, this needs to be a 2-way street between you and your doctor. You need to ensure, and your doctor should be aligned with, understanding what you are trying to accomplish. He or she should respect the decisions that you make when it comes to your health. Too many times, the doctor feels that it's their job to instruct the patient on what they should be doing. And instead, the doctor's role should be to educate the patient and give them the information that they need to make the right decisions for themselves. Let me give you an example of how a remarkable doctor-patient relationship can lead to amazing heart health improvements. I take the time to engage with my patients. Office visits are often an hour long, and even though they may be conducted over telemedicine, we establish that doctor-patient relationship with mutually understood goals. And this can have amazing outcomes. Let me give you a recent example of a patient who came to me having been told by other doctors that there were no options besides taking medications and having a stent placed. And after just a few short months of working together, that patient has completely reversed his heart health. His symptoms of heart disease have gone away. He is more active, has lost weight, reversed his diabetes, and improved his overall health vastly. And that all started with establishing a good, mutually respectful and understanding doctor-patient relationship. So if you're not getting those types of results and you don't have that type of relationship with your physician, maybe it's time to be considering other options. Now, if you have questions or need more information on any of the topics that we're discussing in this video, please feel free to ask. Drop them in the comments below. I want to hear your feedback and insights because that's how I learn from interacting with my patients and with people like you. So let's wrap it up by talking about key strategies for ensuring your doctor's approach complements your heart health objectives. Let's first talk about some questions to ask your doctor to gauge their commitment to your heart health. The first question that you should be asking your doctor to gauge their commitment to your heart health is, what are our shared goals when it comes to my heart health? Make sure that they're understanding what you're trying to tell them your goals are. Another key question to ask is, are they only paying attention to the guidelines, or are they trying to personalize your care to your situation? The next key strategy is understanding the importance of an ongoing dialogue in refining your heart health strategy. Each time that you're having a visit with your physician, you should be reevaluating where you stand when it comes to your heart health goals and what steps are needed to get you closer to your goals and the outcomes that you're looking for. And again, if your doctor won't or can't take the time to do this, it may be a sign that it's time to find another practitioner that can better guide you towards your heart health goals. Now, to wrap up, I want to talk about when and how to find a second opinion if your heart health goals are not being met. We have so many more options today when it comes to finding partners in our heart health journey. The world of telemedicine has opened up the possibilities of seeing doctors throughout the United States and really throughout the world. So don't feel that you need to be restricted to just the doctors that might be in your local area. Sometimes this is going to take some extra effort, and sometimes there's going to be extra costs involved. But those costs are an investment in your heart health. And what is more important than investing in your heart health? So do some searching around, talk to other people that you know have been successful in their heart health journey, and find out who they might be working with. The fact that you've found this channel means that you've probably already taken steps on this journey. And remember, don't settle for anything less than a practitioner that is closely aligned with you and understands your goals and is helping you to achieve them. If you enjoyed this content, please let us know below. Please subscribe to this channel. And if you have other topics that you want us to hear about, please let us know in the comments below.